Well, hello. I am Dan Edwards, and thank you for joining us here in Kettering Health Chats Live. Yes, another exciting night to talk to the experts tonight. And as you are logging in, kind of let us share details of how this operates here. It is a live interactive forum, and it's all about you to ask questions of our Kettering Health expert. And today's topic, I think everyone has suffered from this from time to time. It's back pain. Oh my gosh, your back. It's the anchor of your body. When your back goes, man, you just feel like you're not there completely, and you're quite honestly you're not. Without the back there to be straight in alignment, your immune system suffers, and so much more, which we're going to get into. So for the next 30 minutes, we're going to deliver some good information for you, some important facts on an important topic, because it's all about your quality of life. We want you to have the best quality of life as possible. So weigh in now. Let us know what's on your mind here, what questions you might have, and the possible complications from not getting your back taken care of if you're not treated in a timely fashion. We do have consequences. We're going to talk about that. And so we want to get to as many questions as possible. Just go ahead to the chat feature there. Let us know what you're thinking, and we'll get to those as quickly and as many as we possibly can. So don't delay now. Get in there and chat now. It's like a free consultation with the doctor. This is awesome. So let's welcome our Kettering Health expert, Dr. James Dunlap, orthopedic spine surgeon from Kettering Health. And doctor, we appreciate you being with us here today. And thank you for your patience as we kind of set up our Facebook Live. And there he is, a handsome doctor indeed. Gosh, we almost dressed alike tonight.
There you go.
Except
We
you look
planned
better
it.
than yours. I do with mine, but whatever. Anyway, doctor, thanks so much for being with us tonight. And if we could, as people are kind of logging in and sending in their chat questions, share with us your journey. What brought you to the Dayton region?
Sure. Again, my name is James Dunlap, and I'm an orthopedic spine surgeon with Kettering Brain and Spine. And what initially brought me to the Dayton area was a military transfer. I was stationed at Wright-Patterson Air Force Base, and I worked there as a spine surgeon for the last 10 years. So we've lived here and been a part of the community, and we've raised our children here. And I just recently left the military a couple of years ago, and I joined Kettering Brain and Spine full time, and so that's kind of the short part of that journey. Just to kind of go back just a little bit further, what kind of got me interested in spine? Mm-hmm. Actually, I went to the Air Force Academy initially, and I'll be honest with you, my initial goal was to be a fighter pilot. That didn't quite work out. My eyesight didn't quite fit the requirements, so I went with Plan B. And this was Plan B, and honestly, it's been a great Plan B, and I'm very happy to be doing what I'm doing. I enjoy helping people and making them feel better. So I'm excited to be here tonight and to talk about this topic.
Well, we're delighted to have you, and thank you for your service, by the way.
Thank you.
You made an interesting comment, one that if you're a Daytonian, we've heard a lot. You had no intention of staying in Dayton when you heard you were being stationed at Wright-Patterson.
You're absolutely right. They actually gave me two options when I was coming out of my spinal surgery training. They said, do you want to go to Northern California or do you want to go to Dayton, Ohio? And I'm like, well, maybe we should go to California. Now, it was fortuitous. Things weren't quite set up the way we needed to be successful at this other location. So we came to Dayton not knowing what to expect. And quite frankly, we've loved it here, and we've not left, and we encourage everybody to come visit us and to see what a great place this has been.
And you have what you said, 3 daughters, 15, 13, and 10?
Boy, girl, boy.
Oh, okay.
That's all right. Boy, girl, boy, 15, 13, and 10.
Oh, and how do they like living in the Oakwood area?
They love it. Actually, I was the one thinking about maybe leaving a couple of years ago, just because that was the initial plan. But my wife and my children said, well, you can go. You can come visit us. But so no, they go to the Oakwood school system, which has been a great school system and has taken good care of them and my wife and this community. And I was deployed back in 2017, and that's what really kind of clinched all of this for us, is that the community was so supportive of her and my children while I was gone for 6 months that, it was just so much for us, and to develop those roots was just so important. And so we wanted to continue to be here.
Well, we're pleased and just delighted to have you not only staying in our community and bringing your intellect to this community, but also to have you on tonight's chat. So I guess we probably should chat
Yes.
with some folks here. Let's kind of start with the absolute basics here. What is back pain? How do you qualify back pain?
Yeah, back pain is a big topic. It's a tough topic, and it's hard to kind of put your finger on it. There's really a couple ways to think about it. One way is acute back pain. It means a sudden onset, and it usually is because of some sort of inciting event. Maybe you had worked really hard in the yard that day. Maybe you had lifted something and you didn't use proper body mechanics, and all of a sudden you developed this really pretty sore back. And I'll be honest with you, one of the situations for me was, I would shovel the snow in the driveway, and right after I was done, my back would be on fire. Okay, so that's an acute onset, and it's usually related to some sort of inciting event. The other way to think about it is that it's chronic, right? This is something that you've lived with for now months, maybe even years, and a lot of times it has to do with how our spine starts to break down over time. It becomes degenerative, and it's just like any other part of our body. It just starts to kind of break down, and we have to learn how to, deal with it and try to make it better.
So how many people in America suffer from some sort of back pain?
Yeah, if you haven't suffered from it, then you probably know a friend, a family member, or a colleague, right? So 85% of people in the United States have had back pain at some point in their lives. It's one of the most common reasons to seek medical advice. So it's very common, and I think that this is an important topic, and hopefully we can shed some light on maybe things that people can do at home to make their pain a little better.
Yes, and speaking of home, go ahead and log into the chat session. Dr. Dunlap is an expert from the spine down to your lower back area. So if you have any issues with that, please let us know. Ask your questions now. And you're saying, doctor, that you see mostly patients in their 40s start to come in with what you call the chronic back pain?
Yeah, so I would say that, when we're younger, I think all of us have experienced back pain to some degree. It might be a little bit of a strain, it might be a bruising or something, and then we generally get over it pretty quickly. It might just be a day or two, maybe upwards of a week. But when pain starts to persist more and more, generally it's patients that I'm starting to see in their 40s and beyond. From a surgical standpoint, I would say my most common patient population that we offer surgery to, they're probably in their 60s. Now, that being said, it's a wide range, from 20 all the way up to 90. I've operated on somebody as old as 90. That is having debilitating pain that I can actually help them with from a surgical standpoint.
Okay. You mentioned shoveling snow earlier. My chiropractor told me that anybody over the age of 40 probably shouldn't be shoveling their own snow.
They're right. They're smart to tell you that. So, when you think about what you're doing when you're shoveling snow, you're bending at your back, and then you're digging in there, and then you're twisting, right? All poor body mechanics that I'm doing, right? As a spine surgeon, I'm a little embarrassed to admit that I tell my patients, hey, don't do this, but I do that, right? But I paid the price for that. So do you know what the modification that I did to not have back pain anymore when there's snow in my driveway? Can you guess, Dan?
You hired someone to do it for you.
That would have been probably smarter. But I got a snowblower, right?
Oh, very good. Yeah.
So snowblower, I'm standing upright, my back is nice and straight, and I'm just pushing forward. And guess what? I can do that, and it's actually pretty fun, and it does not hurt my back.
It's kind of cool to throw the snow.
Yeah, it is.
No, you wouldn't. You might have gotten that in Northern California if you hadn't been stationed.
maybe if I went towards Tahoe, I guess.
But the point I'm trying to make though is that you really, back pain can be because of bad mechanics.
For sure.
I was always taught lift with your legs, but we're lazy. We lift with our backs, and that causes problems.
Right, and in the moment it might be okay, but a lifetime of those poor body mechanics build up, right? They build up, and you can develop. So a lot of times when people have chronic pain, it's not just one thing. It can be a lifetime of things.
Right. So talk to me about the difference between lower back pain and then the sciatica. And a lot of folks suffer from, I guess that's a pinched nerve coming through the hip area, that type of thing.
Yes. I don't know if this would be a good time to bring up one of the visuals. You want to do that?
Yeah, slide
Yep.
number 1, Chris, if you would, please, just to give us an overview.
Yeah.
There we go.
So this is just basic spinal anatomy here,
Sure.
and this is, you know, looking at the number of vertebrae here, and just to make it very simple, in the neck it's 7 vertebrae, in the mid back or upper back it's 12,
Right.
and in the lower back it's 5. Okay, and then in between each vertebrae or vertebra is a disc, and that's kind of that cushion in the back, and down the center of the spine. So this is the spinal column that protects your spinal cord and it protects the nerves. But what can happen over time as the discs start to degenerate, as the joints start to degenerate, as you build up bone spurs, unfortunately, it can then cause problems by pinching on nerves and cause you that sciatica. So if we can look at the next slide here.
All right.
And this is just an example of what we call a spinal unit, right? So it's made up of 2 lumbar vertebrae, top and bottom, and the disc in between. And on the back end, you see the facet joint there. And then that yellow there, that's the nerve. So the spinal cord runs through the center, and then what exits out of the spinal cord, out of your spine, are the nerves. And so that's what a relatively normal looking spinal unit looks like. And you can see that it's pretty complex. There's a lot of different parts to just this one unit, and you've got multiple units throughout your spine.
And so that's why it's critical to have that alignment, because as I mentioned earlier, you really, your immune system runs right down your spinal cord.
Right.
And if something's ajar, something's amiss, it really can affect your health, not just your back having pain, but also your ability to get over a cold.
Sure. Yeah, if you're not able to mobilize because you're in pain, that we already know, decreases your health status overall. And to be in pain lowers your immune system. You're absolutely right that anxiety, that stress, that cortisol that is in your body because of the pain you're in, that has an effect on your immune system. Absolutely.
Kind of back to that sciatica, which was a follow-up question here. The person is saying, I'm assuming I have sciatica. Can stretching help, and what kinds of stretching would be helpful? And then cold sensations sometimes in their mid-back. Is it a pinched nerve? Could it be disc damage? What are your thoughts on those 2 questions?
That's a great question, and there's not one easy answer to that.
Okay.
So sciatica can be caused by a mechanical problem. So there's an actual pinched nerve in there, and if you don't mind bringing up that last slide there, or it can be from inflammation. So this slide is just to briefly show you. If you look at that very top level, that's a normal looking disc. We go down 1 level there and you see a herniated disc. That's where some of the disc material actually herniates or comes out of the disc space and goes into the spinal canal. And that can pinch a nerve, and that can cause sciatica. Okay. Now go down 1 level and you see a degenerative disc. And you can see that that's just a disc that has broken down over time, but there's no pinching there, but there can be inflammation there, and that inflammation can cause sciatica.
Right.
And you go down 1 more level, and that last disc there, now you see bone spurs that are protruding into that canal there, and that again becomes another mechanical problem where it is pinching on a nerve. Okay, so sciatica can come from a number of different for a number of different reasons.
Sure.
And yeah, you always want to start with nice, gentle stretching exercises, improve your flexibility around your spine, improve the strength, your muscles, both your abdominal and your back muscles. It's kind of like a bracing around your spine, right? And if you can give your spine that extra support, it can lower some of that inflammation around your spine and actually improve your sciatica.
Yeah. When I was young, I played high school football and injured my back pretty badly, to the point where I had to be taken out on an ambulance during a game. It was bad. Broke a vertebrae, cracked another. And I did okay with it until I got into that 40s area. And my quality of life just went down the tube. My chiropractor couldn't do a whole lot for me. We tried, and he suggested that we do a series of nerve blocks. 1 didn't really help, 2 maybe a little bit, but it went right back to spasming and being tight. And the 3rd saddle block finally gave me enough relief to where my chiropractor could manipulate my spinal cord, get it back to where it should be in alignment, avoiding that spinal fusion, which was the last thing I wanted to do.
Absolutely, absolutely. You know, that's the thing about back pain is that fortunately we have a number of specialists that can assist you in helping improve your back pain. I'm one, right? A spine
Are you?
surgeon,
Okay.
right?
All right.
So spine surgery is over here. Try to make that on camera there. And then we have the other non-operative options over here. And we want
Okay.
to try and maximize that. And a chiropractor is a good option of nice, gentle manipulation around your spine. An osteopathic doctor, the same, that can help you gently manipulate that spine and put it in a better position and help you feel better. A physical therapist, you know, can also help you improve your flexibility and your strength. And a massage therapist can help work those muscles. Using medical acupuncture, actually, it can be very helpful. And then what you were mentioning was injections by a pain specialist, right? So this is a little more interventional. This is putting a needle in your spine. And because your spine is so complex, they are trying injections in multiple areas, right? So for you, the first one, you know, didn't work so well. And so they were trying different spots, but they finally found the spot where it was your, what we call primary pain generator, right? So that's the spot that was causing the pain, and they were able to relieve those symptoms. Now, it's not a long-term fix, and then we, you know, can eventually get into, well, what do I need to do to try to keep my back pain at a reasonable level?
Sure.
To improve your quality of life.
Okay. Well, it leads right into a follow-up question here from one of our viewers tonight. They want to know, what is the best option after having spinal fusion? If that was your option, you went ahead with it. What's the best way to minimize pain after a spinal fusion? Is that the remedy to the issue? I didn't see it was at that time.
So, you know, spinal fusion surgery, or any kind of spine surgery, it doesn't necessarily have to be a fusion surgery, but it is indicated for a very small amount of neck and back pain, meaning that not every neck and back pain has a surgical solution. So as a spine surgeon, I am saying to everybody out there that, you know, be very cautious about proceeding with spine surgery, and just know when the right time is. Surgery cannot fix every neck and back pain problem. I just want to make that very clear.
Sure.
There are certain things that we can make better with surgery, and it usually is the last option in that regard. Now, whether you've had surgery or you haven't had surgery, right? What I tell a lot of my patients is your body is very good at telling you what you can and can't do, what you should or shouldn't do. So if you're starting to do certain activities that are really bothering it a lot, you need to change how you do it, or you might have to avoid it altogether, right? So it means using better body mechanics. It means keeping your core strong. It means improving your diet. It means maintaining optimal weight. It may be these different lifestyle changes to prevent future problems with your back. And again, it doesn't even mean that you had to have surgery. But even if you've had surgery, remember that it's not the final fix, right? It's got you set back on the right path again.
Right.
But you've got to take some steps towards preventing any future mishaps.
This seems to be a hot topic here in our chat box here. Another person weighs in, I have spinal fusion and now PT, and his PT thinks it might be the S1 joint. Can that cause sciatica?
Yeah,
and I
absolutely.
can't walk more than 10 minutes without burning pain.
No, I'm really glad that that this question was asked. It is an under-recognized and under-diagnosed reason for having this low back pain and sciatica. The sacroiliac joint, SI joint, is right between your spine and your hip. And so there's sometimes some confusion that this is a lumbar spine problem, or this is a hip problem. And it's actually in between. It's that SI joint. Your sciatic nerve runs right along your SI joint. And your physical therapist is very astute. And I think a lot of them are understanding this more and more. And people who have had spinal fusion surgery tend to be at a little higher risk of having some dysfunction of that SI joint that can cause them sciatica. The good news is that over the last several years, we have developed a minimally invasive surgery that can assist with that if you're a good candidate. There's a number of steps to kind of go through to see if, can we make it better without surgery? But if we can't make it better without surgery, and you get these set of injections and they're successful, then that means that the surgery has a high chance of success. So it's something that we do at Kettering Health, and can certainly help you in that regard if that's something you're suffering with.
Another question, doctor. Having severe pain in my lower back, into my left buttock, and into my calf. Is this sciatic nerve damage? And if so, I guess they should come see you.
So it probably is a pinched nerve in there. What I would say is, if you have not started anywhere yet, a good place to start is with your primary care physician or advanced practice provider. Somebody that provides you with that primary care, because they generally help us see. If 85% of people who have back pain came and saw me, nobody would be able to get into clinic.
Right.
But no, I would start with them. They would take a history and do a physical exam, kind of help you pinpoint where that pain is coming from. And then they may start you on some medications. It might be a muscle relaxer. It might be a non-steroidal anti-inflammatory, which is like ibuprofen or naproxen or acetaminophen. The brand name is Tylenol. And then they might prescribe you some physical therapy. And you start there, and it might make things better. And then you don't need to see me yet. But at some point, if it's not better, you see me, and we start to look into things a little more.
All right. I have been told, and you're the doctor, you're the expert here, doctor. I've been told that just reaching down to pick up a pen off the floor puts about 3 to 4 times your body weight on your lower lumbar, to give you a perspective of just how fragile that back can be.
Sure.
And getting into those mechanics that you talked about. So the way that you're sitting right now, with your body straight, your spinal cord straight, we need to practice more of these body mechanics.
Absolutely. It's important for us to maintain good body mechanics all the time. If you think about how we all kind of live our day-to-day lives, we have people that are hunched over looking at their cell phones. That causes chronic neck pain, right? Because your head is having to be held up by your spine there, and that's putting a lot of stress and pressure there, right? And then the same thing with your back. When you're hunched over that computer, when you are just walking in a hunch position or sitting in a hunch position, that's putting a lot of pressure on your spine. And you're absolutely correct that contributes to people developing chronic pain. So we really need to think about proper posture, whether you're sitting, standing, or walking. And as you mentioned, you really need to have your chest kind of puffed out, kind of bring your belly in, and just think about being straight all the time. If that means putting a support pillow behind your back while you're sitting, be very conscientious when you are standing and you're walking that you are not hunched over and you're leaning over, that you're upright. And by doing those things, you put less stress on your spine.
Is there a difference? I'm sure there is, but share with us the difference that you have when you're dealing with a patient that may have scoliosis or other ailment of the spinal.
Sure. So just to put it very broadly, there's essentially 2 types of scoliosis. There's the scoliosis that you develop as a child, okay, and there is very young children that can be due to some sort of genetic anomaly, and sometimes they require surgery in the very young years. And then there are teenagers who have scoliosis, and that is a different genetic variation, but fortunately most of the time they don't need surgery. We have great spine surgeons at Dayton Children's that help us to take care of our pediatric patients. But that's something that might need bracing and might lead to surgery, but most of the time does not, fortunately. And then there's the degenerative scoliosis, which is something that our spine group takes care of. And in some patients, as their spine starts to break down and degenerate, it doesn't stay straight anymore, it starts to curve, okay? And when it starts to curve, it can start to pinch up on nerves, and it can increase back pain. So that's scoliosis kind of in a nutshell, but it's a pretty big, broad topic.
Right. I don't mean to be a salesperson for smartwatches, but I have found the value in my smartwatch when have been seated too long, and my smartwatch says, hey, you need to get up and stand up.
Sure.
So beyond being reminded to do that, what's some of the things that we can do during the day? Because a lot of folks are working home now. They're work at home people. They're hybrid, whatever. They're spending more time at that desk and getting that computer back that you talked about. So give us maybe some helpful tips, like stretching. Sure. I'm assuming would be a good thing to do periodically.
Absolutely. And I really like that smartwatch idea, because I have one, and it never occurred to me to mention that to patients. And I don't have any stock in a smartwatch, but maybe I should.
Nor do I.
You're absolutely right, right? We kind of lose track of time and
Mhm.
we stay stuck in a particular position, especially
Right.
hunched over a computer or at our desk just working. Maybe you're working from home or you're working, at the office. And what I have told many of my patients is set a timer, 45 minutes. Your smartwatch is great because it can be that reminder as long as you're listening to it.
Mhm.
But stand up and walk. Take 3 to 5 minutes to just walk around, stretch your spine. Maybe do just some flexibility exercises. Anything that you can do to straighten out your spine.
Yeah.
And I think that's absolutely important and something to consider because we do get stuck in positions when we're just not paying attention.
All right. We have a lot of questions about, it looks like folks have gone through spinal fusion and have questions like one, do steroid shots help with back pain, which I think we kind of touched upon,
Mhm.
or what is different than a burst fracture? I had both one C1 and the other at L1. So there's quite an issue, I would imagine.
Sure. Well, if we're talking specifically about burst fractures, my assumption is that this person may have been in a trauma. So,
Okay.
a lot of what we've been discussing tonight is kind of degenerative spine, things that happen over time as our body breaks down.
Mhm.
But certainly, people can have other spinal injuries related to trauma, and that can be in a high energy accident like a motor vehicle
Mhm.
collision and so forth. And generally speaking, sometimes that does require surgery just because we don't want to, for the patient to have any serious neurologic injury.
Mhm.
But a little bit askew from that topic, talking about fractures is compression fractures, and we're talking about osteoporotic compression fractures, and that is a very serious thing. We are living longer, right? And which is a great thing, except that our bodies have the opportunity to break down further.
Mhm.
And so when our bones start to weaken, it doesn't take much. Sometimes a simple fall, bending over to pick up the laundry basket, and you can end up with a compression fracture of like L1, for example. And it's just because the bones are weak. Now,
I see.
most of the time, those bones will heal. You don't need any intervention. But there are some interventions that can be helpful, such as putting cement in those bones. But ultimately, we're looking at prevention, right? So if you have osteoporosis and you know it, you should be on osteoporosis medications. If you develop what we call a fragility fracture or compression fracture, that means you have osteoporosis and you should start medications, right, to strengthen your bones and prevent future osteoporotic fractures.
Another question, doctor. So, what treatment is there for degenerative scoliosis, and is it safe to buy a back brace to use?
Yeah, I encourage you to get a back brace.
Okay.
As a matter of fact, I always tell folks that probably cheaper to get it on Amazon, but you go to your favorite, outlet and find a nice, good brace that you can cinch up and puts a little extra pressure around your back, and that support makes a lot of people feel better. Okay, so I think that's really good. From a degenerative scoliosis, again, the majority of time, it does not need surgery. There are times when surgery is necessary, and it's a little more complex in terms of looking at your overall alignment. And we know that if your alignment is such where you're very stooped over, basically your head is not over your pelvis, that can significantly affect people's quality of life. And so it is a big surgery to realign your spine and get your head back over your pelvis. But those types of surgeries are not done on a frequent basis, unless you go to a place that completely specializes in it.
Gotcha. Well, that place would be you. Dr. James Dunlap, thank you so much. You've been a delightful guest with great information. Really appreciate it. Thanks to all who have kind of weighed in with some of your questions. We hope they were helpful for your answers, and we appreciate your time. And if you have more, you see the address right there. It is ketteringhealth.org/spine, and see the good Dr. Dunlap, because at Kettering Health, we just want you to be your best. So we appreciate your time, and we hope that you'll be joining us next time, our Kettering Chat Live in September. Our doctor is going to be Dr. Percherel, and we'll be talking about issues there that will concern you, and we hope that you'll join us. And thank you for joining us for Kettering Health Chats Live. On behalf of all of us here, we hope you have a safe and and healthy summer. And we'll see you in September. Remember, Kettering Health, be your best. See you next time.